Shalom. I want to give all praises, blessings, glories, and honors unto Yahweh Bahashim, Yahweh Shai Bahashim, Racha Kodash. Double honors to my elder apostles and bishop elders of Great Millstone who have taught me this truth, as well as men of like mind. Shalom wa chasad, which means peace and mercy, to the elect of the nation of Israel, whom I used to call Negroes, Latinos, Native American Indians, and Israelite foreigners of the seed line of our forefathers, Abraham, Isaac, and Jacob, whom is scattered here in America, which is Babylon the Great, and abroad. And to you I say Shalom and Yahweh Bahashim, Yahweh Shai Ratazah. This lesson is edifying. Revelation chapter 13 verse 16. And he causeth all, both small and great, rich and poor, free and bond, to receive a mark in their right hand or in their foreheads, and that no man might buy or sell save he that had the mark, or the name of the beast, or the number of his name. Here is wisdom. Let him that hath understanding count the number of the beast, for it is the number of a man, and his number is 666. From the Atlanta Journal-Constitution, brain-computer interface successfully implanted in the U.S. for first time. Published on July 22, 2022 by Hunter Boyce. The company had already implanted the devices in 4 Australian patients. Endovascular Brain-Computer Interface (BCI) company Synchron announced the first successful human brain-computer interface implementation within the U.S. on Tuesday, beating Tesla titan Elon Musk's Neuralink to the punch. Clinical investigator Shahram Majidi, MD, assistant professor of neurosurgery, neurology, and radiology at the Icahn School of Medicine, at New York's Mount Sinai West Medical Center, led the procedure. The procedure was carried out within the center's angiography suite, with a minimally invasive endovascular approach. Synchron on Twitter stated, "We're honored to announce the first human BCI implant using an endovascular approach in the United States. This is a historic milestone for humanity, which will forever change how people with paralysis interact with the world." And this is one of the excuses of so-called convenience that they will use to sway and persuade the minds of people into willingly taking their MOTB, which is really the Heavenly Father Yahweh's MOTB, on the left-hand side through the spiritual demon Satan, through his physical counterpart on the earth, which is Esau Edom. Because the goal of their NWO agenda is to cause all, both small and great, rich and poor, free and bond, to receive a mark, which is the RFID microchip, also known as the NFC chip implant in Europe, also known as the biochip implant. The word bio means body or living. Chip implant. Okay? In their right hands or in their foreheads. And this is an example of in their foreheads. That concludes a brief presentation of the functionality of this device, which will forever change how people with paralysis interact with the world. The procedure marks the first U.S. patient implant in Cycron's command trial, which is being conducted under the first investigational device exemption IDE awarded by the FDA to a company assessing a permanently implanted BCI. The company said in a news released on Tuesday, the U.S.-based trial is being conducted with support from the NIH Neural Interfaces Program. Synchron previously implanted devices in 4 Australian patients suffering from severe paralysis. The company reported no serious adverse events a full 12 months after the devices were implanted.
Who is this patient and why did they decide to do this, Tom?
We're not talking too much about the patient, Emily, out of his respect for privacy, but I can say it's a patient that has a severe paralysis due to ALS, and he is not able to use his hands, he's not able to speak, and he depends on assistive technologies to communicate with his family and friends, and he's looking for a way to improve that capability.
So how will this implant help him?
The concept with a BCI is essentially the idea that we have become dependent on digital devices to engage with the world, that there's a part of the brain that controls our fingers. We use our fingers to do point and click, and if we can go straight to the source in the brain that controls the intention to do point and click, put a sensor in there, you can decode the information out of the brain and then control point and click without the need for your hands to do that. It comes directly from the brain.
What are you hoping to learn from this patient's experience?
This has been a long journey. We became the first company to get a IDE approval from the FDA to conduct a study of a permanently implanted BCI. We're still primarily focused on safety, but we're now starting to test out how we measure efficacy. So the FDA has publicly stated that it's not obvious how we would quantify the effectiveness of a BCI, and we're starting to test out some of those parameters with a view towards preparing that packet for FDA approval and then going to commercial launch.
Now, as I understand it, your technology is ahead of what Elon Musk has accomplished so far at Neuralink. How much farther ahead, and how is what you're trying to do different than what he is trying to do?
I would say we're at the beginning of a renaissance of brain science, and I think this is going to be a huge problem that's solved for many, many patients. So there are many ways to try to solve the problem. The way that we're doing it is going into the brain through the blood vessels. We're on a particular path with FDA, and we've been able to leverage decades of knowledge around safety of leaving devices in blood vessels, and the way that we can expect the body to react to that. So it's a different approach. It's a big problem, and I think there are going to be many approaches needed, but we're excited to be finally getting into the clinical stage in the US after 5 years of discussion with FDA and demonstration of safety and testing of our technology.
So who do you imagine will be doing this in the nearer term future and in the longer term future? Is this something that you see anyone opting to do?
Well, I think paralysis is a massive problem. We probably all know someone who's lost the ability to use their hands. Stroke, spinal cord injury, ALS, muscular dystrophy, multiple sclerosis. Many conditions make our body ineffective while our brain is still working. So our big focus is to show that this technology is effective for a patient population initially. And I think the way I think about where this technology is going, it's going to be something like LASIK. It's an elective procedure. It helps you engage with technology more. You reconnect with the world. You overcome physical disabilities, and you reestablish your digital world.
So you think that in the future, putting a device inside your brain will be as easy and simple and desirable as getting LASIK eye surgery?
Well, LASIK eye surgery is a minor procedure. It's still a laser on your eyeball. It comes with risk, and it takes a couple of hours. It's in a day procedure unit. That's the types of physicians that are putting in stents and pacemakers are using the same technology that would be putting in a brain-computer interface if it goes through the blood vessels. So that's a cath lab, and they are thousands of them across the country with many, many physicians who can perform the procedure. It's a day procedure. It's invisible to the outside world, and it helps you reconnect, and it offsets our, all of the things that come with a human body that can fail for a number of reasons.
The first in-human implant of an endovascular BCI in the US is a major clinical milestone that opens up new possibilities for patients with paralysis, Tom Oxland, MD, PhD, CEO, and founder, Synchron said in the news release. Our technology is for the millions of people who have lost the ability to use their hands to control digital devices. We're excited to advance a scalable BCI solution to market, one that has the potential to transform so many lives. According to Majidi, it's a human achievement with serious implications for the field. This is an incredibly exciting milestone for the field because of its implications and huge potential, Majidi said. The implantation procedure went extremely well, and the patient was able to go home 48 hours after the surgery. This concludes the article. So this is just another example of the hegemony of Esau Edom's gradual steps towards their global introduction and subsequent mandation of the MOTB. Okay? This is nothing more than gradualism towards the MOTB. And so this article has been concluded. Now, another article from The Hill: revolutionary brain-computer interface offers hope to paralyzed patients, which goes hand in hand with the last article that we just reviewed. I think brain-computer interface is an example of a type of tool that is going to be used as we unlock the brain and start to treat conditions that were previously untreated and previously impossible. Now, I'm not going to read this article because this article pretty much shares the same sentiments of the last, and the whole perspective is that they are working on brain implants that they will push as being a tool of so-called convenience for the paralyzed. And we understand, according to local prophecy, this ties into the MOTB, the mark of the beast, okay, which is the tool that Esau Edom is going to use when they introduce the globe to their New World Order agenda to enforce their dominance, okay? The first permanent brain-computer interface was implanted in a patient in the US, and we just read that. Technology is intended to give several paralyzed people the ability to control a computer using only their thoughts. Brain-computer interface developer Synchron has developed a novel approach to the procedure that has started an FDA approval early feasibility study. So I'm not going to read this article. Instead, I'll leave it in the description box of the lesson, Lord's willing. Now let's go back to the scriptures and conclude the lesson. Again, this is the book of Revelation, chapter 13, verse 16. And the he is referring to the hegemony of Esau Edom, the so-called Caucasian race, beginning with their banking families, their Rothschilds, their Gettys, their DuPonts, their McDonald's, their Lees, so on and so forth. Cause of all people on the earth, except for the elect of the nation of Israel, whom the Lord Yahweh, through his son Yahushua, will keep from the hour of temptation, according to the book of Revelation, the 3rd chapter, which I pray that I am of the elect, as well as your brothers and few sisters, both small and great, from a newborn baby to an elderly senior in society, rich and poor, whether they be rich or poor, free and bond, whether they be free or bond in society, in the jail systems, to receive a mark. That mark is the MOTB, the RFID microchip, also known as the NFC chip implant, also known as the biochip. Bio means alive or living, in their right hand or in their foreheads. In this lesson, we had read 2 articles, one more briefly than the other, that's concerning brain chip implants, okay, that will go where? In the foreheads of individuals that are paralyzed, okay, meaning in front of their brain or on top of their brain. This is associated with the MOTB, with that mark, and that no man might buy or sell save he that had the mark. So no one will be able to buy or sell, will be able to perform traffic in society unless they have that mark in their right hand or in their foreheads. Or the name of the beast. The beast is the pagan Roman Empire, which came back in the form of NATO and the EU, with America being an extension of that empire. That is the beast, or the number of his name. Here is wisdom. Let him that hath understanding count the number of the beast, for it is the number of a man, and his number is 666, 666, which is associated with the Universal Product Code, UPC, which we typically see behind products in stores, on the shelves, in the form of three horizontal lines, one in the very far right, one in the very far left, and one in the middle, which represents 666, which is a UPC that they use to track products across the globe, where they're being shipped to, where they're being transported to, so on and so forth. But now they'll be able to track things through what is known as a centralized blockchain, which is a network that will be overseen by a central authority such as a central bank. Okay, so now Edom will be able to see people's transactions, all the things that they do via this network, this centralized network, okay? Because within the chip, people's information are going to be stored, everything about them, literally everything, okay? And this is the judgment for those that take that chip. So the message out there to you so-called Negroes, Latinos, and Native American Indians that may come across this lesson that hadn't known what the MOTB is, but now that you do, through the spirit and power of Yahweh Ba'ashem Yahweh Shai Ba'ashem Chakodash, the message is to not take the MOTB when they mandate it, because it will be mandated according to biblical prophecy. Because if you take it, this is the judgment. Revelation chapter 14, verse 9, and the third angel followed them, saying with a loud voice, if any man worship the beast in his image, the image is not an image of Caesar Borgia. The image is the system. Okay, but it's comprised of this man's medical infrastructure, his financial infrastructure, his architectural infrastructure, his laws, okay, his military, his technology, everything that comprises the system is the image. And receive his mark in his forehead or in his hand. And this is not medical misinformation, by the way. Okay? The same shall drink of the wine of the wrath of Yahweh Ba'ashem Yahweh Shai, which is poured out without mixture into the cup of his indignation, which means righteous anger. Through what? Intercontinental ballistic nuclear fire. And he shall be tormented with fire, nuclear fire that is, and brimstone in the presence of the holy angels and in the presence of the Lamb, who is the Lamb or Lord Yahweh Shai. And the smoke of their torment ascend up forever and never, meaning for a period of time, and they have no rest day nor night, who worship the beast in his image, and whosoever receiveth the mark of his name. There are many other scriptures that references the MOTB, but I'll conclude the lesson here. Lord's Angle was edifying. Brothers can leave precepts in the comment section of the lesson. And with that, I'll conclude the lesson here. Lord's Angle was edifying and informative to the elect. Shalom.